Hey everyone, and welcome. Ever feel like health plans are this giant, confusing thing that you just can't quite wrap your head around?
Well, you're definitely not alone.
Well, good, because today we're going deep, deep into the world of health plans.
Yeah. It's gonna be a wild ride.
Whether you're a healthcare professional or you're a student,
Student?
or maybe you're just someone who's, curious about how this whole system works.
Just interested.
We are here to kind of break it all down and decode it all.
We are going to decode it for you.
I take you on a little journey
Yeah, a little journey.
through the evolution of health plans.
Exactly.
From their really surprisingly early beginnings
Yes.
to the very complex landscape that we see today.
It's very complex.
And get this,
Yeah.
health plans have been around way longer than you might think.
Oh, way longer.
We're talking 1910.
Yeah. Like over 100 years.
I know. And then by 2008, the U.S. was spending, get this, 16.2% of its GDP on healthcare.
Wow.
That's a massive, massive chunk of change.
That is a lot of money.
Okay, so let's start with some basics here.
Okay.
What exactly do we mean when we talk about managed care?
Yes.
It sounds kind of, I don't know, controlling.
Yeah, it does sound a little bit controlling, doesn't it?
A little bit.
But really, when we talk about managed care, what we're talking about is finding that sweet spot between how we deliver healthcare
Okay.
and then also how we pay for it.
Okay.
So we're looking at creating these systems that kind of connect those two, really important parts of the puzzle.
I see.
Delivery of care,
Okay.
financing of care, bringing those together.
We're less about controlling and more about coordinating.
Yes, exactly. Coordinating, making sure people get the care they need in an efficient way,
Okay.
but also keeping costs, reasonable, under control.
Yeah. Got to watch the bottom line.
Yeah, and that's where health plans come in.
Oh,
They're
yeah.
kind of the ones who are doing that. Negotiating with doctors and hospitals, figuring out those payment structures,
Yeah.
trying to make sure that the whole system kind of runs smoothly,
So they're like the conductors of the healthcare orchestra.
Yes, I like that. I like that analogy.
Now, you mentioned that health plans existed as far back as 1910.
It's true.
That is before, we had antibiotics.
Mm-hmm.
Really before most modern medical technology.
Yeah.
What did these early plans even look like?
Okay, so picture this. 1910, you join a prepaid group practice. You pay a monthly fee.
Mm-hmm.
And in return, you get access to this specific group of doctors for all sorts of services.
Right.
And that, believe it or not, is actually the earliest form of what we now call HMOs,
Wow.
Health Maintenance Organizations.
HMOs in 1910.
It's crazy.
That is fascinating.
Yeah, so it all started with these group practices.
Okay, so it starts there, and then what?
It evolves.
Okay.
So in the 1920s and 30s, we see these new players come on the scene.
Okay.
Blue Cross and Blue Shield emerge.
Oh, familiar names.
Yeah, so Blue Cross focuses on hospital care.
Okay.
Blue Shield's taking care of physician services.
I see.
So it's really the beginning of separating those two pieces of the healthcare puzzle.
Okay, interesting. So we've got group practices, we've got Blue Cross and Blue Shield popping up.
Mm-hmm.
What comes next in this grand health plan saga?
Okay, well, a really big shift happens in 1954.
Okay.
Something called IPAs.
IPA.
Yeah, Independent Practice Associations.
Okay.
And what this did was it allowed doctors who weren't part of these big prepaid groups to still participate in health plans.
Okay.
So it gave doctors more independence.
Yeah.
It gave patients more choice.
So more options coming into play.
More options, exactly.
And I'm curious, what role did the government play in all of this?
Oh, that's a great question.
Were they just kind of watching from the sidelines, or were they actively shaping this whole health plan landscape?
No, they were not just watching.
Okay.
The government's role is huge.
Okay.
So in 1973, the HMO Act comes along
Okay.
and basically gives HMOs this big boost.
Oh.
The federal government, they saw HMOs as a way to try to control costs, make healthcare more accessible. So
Wow.
they really threw their support behind it.
So they were actively promoting this managed care model
Absolutely.
through HMOs.
Yeah.
But didn't people want more choice?
Yeah.
I mean, being restricted to, a specific network of doctors can feel limiting.
Yeah, it can feel limiting.
Yeah.
And you're right, by the 1990s, consumers and employers, they were really starting to say, hey, we want more flexibility.
Yeah.
We don't want to be stuck just seeing doctors within this, little HMO network.
Yeah.
We want options.
Right.
And that desire for options really drove a whole new wave of health plans.
It did. It did.
What did we see come out of that?
So we saw the rise of PPOs,
PPOs.
preferred provider organizations.
Okay.
And PPOs, they give you that flexibility to
Right.
go see those out-of-network doctors,
Hmm.
but it often comes at a higher cost.
That makes sense.
And then you've also got POS plans,
POS.
point of service plans.
Okay.
Kind of try to blend the best of both worlds.
Yeah. A little bit of HMO, a little bit of traditional insurance.
Yeah, a hybrid.
A hybrid.
So it sounds like health plans were kind of playing this game of catch up,
They were.
trying to keep pace with what people wanted.
Absolutely.
This ever-changing world of healthcare,
Right.
this constant evolution, this wanting more, better,
Mm-hmm.
it must put a strain on the system.
It absolutely did.
Yeah.
And that brings us to one of the, I think, biggest challenges
Okay.
that health plans face today.
What's that?
The ever-rising cost of healthcare.
Oh, yeah.
The elephant in the room.
I feel like that elephant's getting bigger.
It is getting bigger.
Yeah.
That's a challenge.
That is a good place to pause for now, though.
Okay.
We've gone from these, like, early prepaid group practices to this whole spectrum of different plans,
Yep.
HMOs, PPOs,
Mm-hmm.
POS plans.
POS plans. Yeah.
And it seems like that desire for choice and those rising costs are two big drivers.
They really have been major drivers.
Yeah, shaping the whole thing.
Shaping this evolution.
Yeah.
Yeah. And when we come back, we're going to talk more about how health plans are dealing with these challenges.
Yes.
How are they trying to control costs, but also make sure people are getting good quality care?
That's a great question.
We'll talk about it all when we come back.
Sounds good.
Yeah.
All right, so we've made our way through the history of health plans,
We have.
and it's clear that rising costs, that's a big challenge.
It really is.
But it also seems like patients, like people, they're getting more of a, say, more control over their health care these days,
Yeah, absolutely.
which is pretty cool.
It is.
Yeah, it's a good thing.
So that shift towards patient empowerment, it's a key trend that we're seeing.
Okay.
And it's not just about having more choices.
Right?
It's really about giving people the tools, the knowledge, the resources to make really informed decisions.
Okay, so how are health plans actually, like, putting
Yeah.
this empowerment into practice? What are they doing?
So one example is something called consumer-directed health plans,
Okay.
or CDHPs.
CDHPs.
And these plans often have what's called a high deductible,
Okay.
but they're paired with something called a health savings account, or HSA.
I see. So you pay more out of pocket
Yeah.
before the insurance kicks in,
Yeah,
but then you also have more control over how that healthcare money is spent.
exactly.
Okay.
So that's the basic idea.
Got it.
With an HSA, you can set aside pre-tax money
Mhm.
to cover those healthcare expenses.
Okay.
And it's really about ownership,
Yeah.
flexibility,
Makes sense.
and some CDHPs even incentivize healthy behaviors.
Oh, interesting.
Like they might give you lower premiums,
Right.
even contribute to your HSA if you're, taking care of yourself.
And that's pretty cool.
Yeah.
But CDHPs, it feels like they might not be for everyone.
Yeah, that's true.
I mean, that high deductible, that could be a lot for some folks,
It can be.
especially if they've got a chronic illness
Right.
or unexpected medical expenses pop up.
Yeah, so you're right.
Yeah.
CDHPs, they often appeal to maybe younger, healthier individuals who don't anticipate needing a lot of medical care.
Yeah, if you don't go to the doctor that often.
Exactly.
Yeah.
But somebody with ongoing healthcare needs,
Yeah,
they might prefer a plan with a lower deductible,
makes sense.
even though those monthly premiums might be a bit higher.
Okay, so it's all about finding the right fit
It is.
for your own situation.
Your own situation.
your needs.
Absolutely.
But it's good that there are these options out there
Yes.
to try to cater to, lots of different people.
Yeah, it's all about choice, right?
It is. It is.
Yeah.
Now, I'm curious about how technology is impacting all of this.
Oh, yeah.
I mean, we are living in the age of smartphones,
We are.
artificial intelligence, AI.
AI is everywhere.
It's got to be shaking things up in the world of health plans.
Oh, absolutely.
yeah.
It is.
In what ways?
So one of the big ways is that it's helping us shift towards this idea of value-based care.
Value-based care. Okay.
Yeah, and it's all about moving away from just paying for the number of services.
Okay.
Like how many times you go to the doctor,
Yeah.
how many tests you get.
Got it.
And instead, focusing on what was the quality of that care? What were the outcomes? Did it actually help you get better?
So value over volume.
Value over volume. Yeah, I like that.
Yeah.
But how do we actually measure value in healthcare?
That's a great question.
It's a tricky one.
I mean, it seems kind of subjective, right?
It can be, yeah.
Yeah.
But there are ways to quantify it.
Okay.
So, for instance, we look at things like how satisfied are patients?
Mm-hmm.
How well are chronic conditions being managed?
Okay.
Are people ending up back in the hospital a lot? Or are they staying healthy?
So it's about looking at the big picture,
The big picture, exactly.
not just those,
Yeah.
like one-off incidents of care.
Right.
Yeah.
And technology is really key here
Okay.
because with things like electronic health records,
Hmm.
remote monitoring devices,
Okay.
all this, fancy data analytics,
Yeah.
we can track those patient outcomes
Mhm.
in a much more effective way. And we can identify areas where we need to improve.
It sounds like data is becoming like the new currency.
It really is. It's playing a bigger and bigger role.
In healthcare, yeah.
And this leads us to another exciting development,
What's that?
the rise of artificial intelligence.
Oh, AI.
AI?
Like robots doing surgery?
Well, there are robots assisting in surgeries.
Oh, wow.
But the real power of AI is actually in its ability to analyze massive amounts of data
Okay.
and identify patterns that humans might miss.
I see.
So imagine algorithms
Okay.
that can detect early signs of disease just from looking at medical images.
Wow.
Or personalize your treatment plan
Okay.
based on your unique genetic profile.
So this is like real stuff. It's not just sci-fi.
This is real stuff.
Wow, that's incredible.
Yeah, and we're already seeing AI being used to diagnose conditions like cancer, heart disease, with amazing accuracy.
That's amazing.
And AI-powered chatbots are helping patients
Oh, wow.
manage chronic conditions, even provide mental health support.
Okay, but what about, the human touch?
Yeah.
Are doctors and nurses just going to be obsolete in this, like, new AI world?
I don't think so.
Okay.
I think it's less about replacing humans and more about augmenting what they can do.
I see.
So AI can handle those routine tasks. It can analyze that data, give us insights,
Yeah.
freeing up clinicians to do what they do best,
Which is?
build relationships with patients,
Mm-hmm.
provide emotional support,
Yeah.
make those complex medical decisions.
So it's more about collaboration.
Exactly. Collaboration, not competition.
Yeah.
AI as a tool
Yeah.
in the hands of skilled healthcare professionals.
Makes sense.
And that collaboration, it can lead to better outcomes for patients,
Okay.
more efficient care,
Yeah.
and ultimately a more sustainable healthcare system.
But like with any powerful technology, there's got to be some ethical stuff to think about, right?
Oh, absolutely. Yeah. We
Yeah.
need to be mindful of the downsides.
Yeah. What are some of those potential downsides?
Well, making sure that AI is used responsibly doesn't create biases
Yeah.
or disparities in who has access to care.
Yeah. Making sure it's equitable.
Exactly. And we need to be having those conversations about data privacy,
Mm-hmm.
algorithmic bias,
Yeah.
making sure everyone benefits
Right.
from these advancements.
It sounds like we're really like on the edge of this major transformation in healthcare
We are.
with technology playing this big leading role.
It is.
It's exciting. It's also a little bit, kind of daunting.
A little bit scary.
A little bit scary, yeah.
The big change.
It is a big change. But it's clear that the future of health plans is totally intertwined with the future of technology.
Absolutely. Yeah.
Now, when we come back in the final part of our deep dive,
Yes.
we're going to delve into some of the more, intricate details.
The nitty-gritty.
The nitty-gritty, yes.
Yeah.
Of how these health plans operate.
Behind the scenes.
Behind the scenes.
Yeah, the stuff people don't realize is going on.
Exactly.
It's fascinating.
It is. Okay. So we've covered a lot of ground.
We have.
The history of health plans, how they've evolved,
Yeah.
how technology is changing things.
Big time.
But I have a confession.
Oh.
All that behind-the-scenes financial stuff,
Uh-huh.
the stuff that makes my eyes kind of glaze over a little.
Kind of number crunching?
Yeah.
Yeah.
That's where I need some, serious decoding help.
Okay, you're talking about the world of risk adjustment,
Okay.
reinsurance, risk corridors.
It sounds so complicated.
It does sound complicated, but it's actually, once you understand the logic, it's pretty fascinating.
All right, I'm all ears. Let's start with risk adjustment.
Okay.
It sounds like something you do before bungee jumping.
Well, in a way, it is about mitigating risk,
Okay.
but not the jumping off a bridge kind of risk.
Okay.
So imagine you have two health plans.
Mm-hmm.
One covers a group of marathon runners.
Okay, healthy folks.
Very healthy, right?
Yeah.
The other plan covers a group of people with chronic health conditions.
Okay, so very different populations.
Very different. And naturally, the plan that's covering those folks with chronic conditions, they're going to face higher costs.
That makes sense. Taking care of people who need more care is going to cost more.
Exactly. And that's where risk adjustment comes in.
Okay.
It's a system that basically transfers funds from plans with those healthier enrollees to plans that have, less healthy enrollees.
So it's kind of like this balancing act
It is.
to prevent plans from being, penalized
Yeah.
for covering people who just need more care.
Exactly. It levels the playing field,
Okay,
makes it fair for everyone.
I see. So risk adjustment makes things more equitable.
It does.
Okay, so that's one piece of the puzzle. What about reinsurance?
Reinsurances.
Is that like insurance for the insurance companies?
It is. It's basically a safety net for health plans.
Okay.
It protects them from those really catastrophic claims.
Okay, like what kind of claims are we talking about?
Like the really, really high cost cases.
Yeah.
The ones that could potentially like bankrupt a plan.
I see. So let's say someone has a very rare condition
Mhm.
that requires like $1 million treatment.
Okay.
Reinsurance would help cover those costs,
It would.
so the health plan doesn't go under.
Exactly. It's about protecting everybody.
Okay, so risk adjustment kind of evens things out between the different plans.
Right.
And reinsurance protects plans from those really extreme cases.
The outliers.
The outliers, okay. Now, what about those mysterious risk corridors?
Oh, the risk corridors.
Are we entering some kind of healthcare twilight zone here?
Not quite.
Okay.
So risk corridors, they were actually a temporary program
Oh.
under the Affordable Care Act,
Okay.
and they were designed to help smooth out the transition
Okay.
to those new marketplaces.
The marketplace is created by the Affordable Care Act.
Exactly.
Okay.
Because, it was a big change.
It was.
Nobody was quite sure how things were going to shake out.
Yeah.
So the risk corridors were kind of a safety net during this time of uncertainty.
Like a buffer.
A buffer, yeah.
Okay.
To protect the plans.
Got it. So risk adjustment, reinsurance, these risk corridors.
Yep.
It seems like they're all about, managing the money side of things.
They are.
But where does quality fit into all of this?
Ah, that's a great question.
Yeah.
And the good news is that quality is becoming more and more central
Okay.
to how health plans operate, how they're evaluated.
So it's not just about the bottom line anymore.
It's not just about the money, it's about making sure people get the best possible care.
Okay, so we touched on accreditation from organizations like NCQA, URAC.
Yeah.
But are there other ways to measure the quality of a health plan?
Absolutely, there are.
Like what?
So 2 common measures are HEDIS measures
HEDIS measures, okay.
and then star ratings.
Those names sound familiar, but I don't really know what they mean.
Okay, so HEDIS stands for Healthcare Effectiveness Data and Information Set.
Okay.
It's a mouthful.
It is a mouthful?
But basically, it's a set of performance measures that look at things like how often are people getting those recommended preventive screenings? How well are chronic conditions being managed?
Okay.
They even look at patient satisfaction surveys.
Oh, interesting.
So it's a really comprehensive way to assess a health plan's performance.
Okay, so that's 80s.
That's HEDI.
And then star ratings.
Star ratings are a little bit simpler.
Okay.
They're more consumer-friendly, I think.
Okay.
So basically, plans are given a rating
Okay.
from 1 to 5 stars,
Okay.
5 stars being the best.
So it's kind of like a rating system to help people compare different plans.
Exactly. Make it easier to understand.
Easy to understand at a glance.
At a glance.
God, it's incredible how much data and analysis
There's some...
goes into evaluating these health plans.
There is.
It's not just about finding the cheapest plan anymore.
It's not.
It's about finding a plan that actually delivers, good value.
Right.
And good quality care.
Absolutely. And that brings us back to that idea of patient empowerment. Because with all this information available, people can make much more informed choices.
Okay, so what advice would you give to someone who's trying to, navigate this world of health plans
Okay.
and actually make a good decision for themselves?
So first and foremost, do your research.
Okay.
Don't just settle for the first plan you see.
Mm-hmm.
Compare the different plans.
Okay.
Look at the coverage, the costs, the provider networks, those quality ratings we talked about.
So it's about finding that balance between affordability, access to the doctors you want,
right,
and a plan that actually, has a good track record.
Exactly. You want quality.
Quality, yeah.
And also, think about your individual needs.
Okay.
Do you have any chronic conditions? Are you planning on starting a family?
Yeah.
Are there any big medical expenses you're anticipating?
So it's kind of like choosing the right pair of hose.
It is.
They need to fit your lifestyle.
Absolutely.
Support you where you need it.
That's a great analogy.
And don't be afraid to ask for help, right?
Yeah, there are resources out there.
Yeah.
Healthcare navigators, benefits counselors, they can help.
Yeah, they can walk you through
They
it.
can answer questions.
This has been such a insightful journey
It has.
through this world of health plans.
It's a fascinating world.
It is. We've covered so much.
We have from the beginning.
From the very beginning to all these financial mechanisms.
The inner workings.
The inner workings, yeah.
Stuff people don't see.
And, to that growing emphasis on quality.
Absolutely.
And patients actually having more of a say.
It's a good thing.
It is a good thing.
Yeah.
And, this landscape is always changing too.
It is always evolving.
Yeah, new technologies, new innovations.
All the time.
But the big takeaway for our listeners today.
Yes.
Knowledge is power, right?
Knowledge is power.
The more you understand about health plans, the better you're able to make those decisions.
Absolutely.
Advocate for yourself.
For yourself, for your health.
So as we wrap up this deep dive today,
we
encourage you to, stay curious.
Stay curious.
Stay informed.
Stay informed.
And stay engaged. Because this is an ongoing conversation.
It is.
About healthcare. Right.
Yeah. The future of health plans is in our hands.
It really is.
Yeah.
Thanks for joining us on this deep dive.
Thanks, everyone.
We'll see you next time.
For another adventure.
Into the world of healthcare.
Sounds good.